Well, thank you very much. Thank you for coming. I realize that for many of you, this represents the morning after the night before, and that you must have either felt to be here for some ulterior motive or a genuine interest. Be that as it may, I'm going to offer you a summary in the beginning so that those of you that felt you needed to be here but wish to fall asleep can do so without missing the punchline. For those that would like to follow along, I hope that I'm going to take you on a journey that is going to give you some language and a scaffolding of thought that may open up an area that you really probably haven't had the luxury to explore, and certainly not in a clinical setting. So it's going to cover a very broad range, because you see, healing the heart covers areas of biology. It covers parts of psychology, psychiatry, and of course spirituality. And we need to delve into each of these areas to some extent. And I think just by way of introduction, what I'd like to do this morning is to give you a fresh look. Just allow you to think outside the box a little bit. Because usually when we approach things spiritual, we start looking at them from a religious lens. But what I would like us to do is to look at this from a form of physiology. In other words, what I'm trying to do is to give you a framework in which to think of this capacity that we have in the context of the rest of the features of our life. Now, having said that, let me, as disclaimer, say that I personally do have strong spiritual views that fall in the Judeo-Christian spectrum, and I'm deliberately being vague because I don't want you to put me in a box. Because we tend to put people in boxes, and that denies us the opportunity to really talk about these things in safety. The second aspect related to that is that I have a deep regard for other people and their persuasions of faith. So I don't have a religious agenda this morning. I have a spiritual physiology agenda. And just so that you know that that's where I'm coming from. Much of what I'm going to present to you this morning is original. In other words, it's my impressions, it's the things that I've discovered in studies, obviously influenced by some people that I'll refer to. But what I found in my own life is that we tend to move from ignorance, and then we have a sort of a stage of arrogance, make enough mistakes, and then we become a bit more cautious. So I hold my conclusions loosely. And the reason for putting copyright on some of the slides is so that I can fess up for the mistakes I may be making and have the right to change them. So that's the primary objective behind this. But what I trust will happen is that you, as you reflect on these things, will find their consistency. And what I hope ultimately something that you can use every single day for the rest of your lives, and may frame some of your own journey as well as that of your patients. Now, if you're wondering what on earth are you doing here listening to this dude from South Africa talking about spirituality, let me start by saying if you told me 6 years ago that I'd be standing here talking about this topic, I would have said you're off the rocker. Because I have a conventional medical background, studied at Pretoria University in medicine, then at Duke University. So I had the opportunity to do my degree in pencil and in pen in the United States, practiced here as well at Duke University for a year in hyperbaric medicine. And I'm only saying that so that you know that my background is conventional. But what got me interested in this area was that I had a patient with psoriasis in my 4th year of medicine. And the dermatologist at that stage indicated that they didn't know what the root was, but we were going to be using coal tar, UVB light, and cortisone. And I just thought that something's wrong with that. But I didn't have any resources to help me figure out what better to offer. And I think the frustration of 20 years of clinical practice not being able to answer that question has in part led me to this point. There have been other influences. There has been an opportunity to study chemicals, rats and humans in different academic centers. Hyperbaric medicine was where I bumped into wound care, and that's why I'm even engaging at this forum. I, through the aerospace medicine interest, had an opportunity to look at some vestibular and oto neurology, and much of that also relates to things spiritual. And then at the moment, I'm actually working in an area looking at genetic problems as a way in which we can actively intervene in people's lives in a meaningful way based on objective information. So if you look at my CV, I guess sometimes I even think, what am I going to be when I grow up? Because it's taken a number of courses, but the theme has been identifying a need, realizing that something had to be done, a resource that people needed, and committing towards developing that, setting that up, and moving on. So I don't know which season I'm in at the moment, but this seems to be the call in this season. Now, I promised you a summary of what I'm going to say, and then we'll move into the detail. And the summary is really this. When we look at things physical and biological, we tend to find three units of interacting components. And those are information, matter, and energy. They're in the language of the sciences of the universe, and they're in the languages of biology in the form of DNA and the substance of protein and the different substrates of energy. So this is very much a theme in the physical and in the biological sciences. This gives us the mechanisms, and for the most part in the sciences we study mechanism, and we almost obsessed about finding mechanisms, because mechanisms not only give us justification, but they also tend to give us leverage points. If we understand the mechanism, we can intervene. So that's usually the reason why we do that. When it comes to the level of the mind, then we are in a slightly different dimension. Then we're interested in things like relationships. We're interested in resources, and I'll explain this as I go along, so I'm just giving you a cliffhanger at the moment, and rituals. And those ultimately produce meaning. Just let that sit for a while. Okay, then the third level is the spiritual. And the spiritual may be represented again with three components: mystical, spiritual, and I'm going to define them, and religion. This gives you purpose. Okay, so that's what primes us, motivates us in terms of purpose. Now, in terms of your patient, or the end point of what you may be using when you leave today, is going to be using an instrument such as this that allows you to probe the spiritual orientation of your patient in a non-offensive way, so as to meet their needs and to have a patient-centered approach for their sake. And it was developed by Harold Koenig, published in the Journal of the American Association, and it covers whether your spiritual or religious beliefs are a source of comfort, C, or stress, S, whether they influence your care or may impact your care, whether you are a member of a religious organization for the purpose of support and understanding, or whether there's anything else, any other considerations. All right? So that's the framework. Here we go. We're in a season where there is really an amazing awakening for what we would have to call spiritual issues. In the sciences, we are starting to see that quantum physics is producing explanations, if you like, or principles that really are extending our previous very, very defined understanding of our world. We've changed from triangles and spheres into uncertainty, observer effect, Heisenberg's principle, things moving in and out of different states of matter to energy. So it has really produced a scientific world that is not incompatible with what has always been understood to be spirituality. What it has also done is it has given us a way to look at certain things in the form of patterns. And what I showed you earlier are three of those patterns. Now, I'm going to tie all the knots together if you're prepared to hang in there as I take you through it. But let me build this up by saying that much of the advance that we are appreciating now in trying to unpack the soul-spirit distinction, if you like, lies in our ability to identify patterns and meaning. Now, it's very abstract. I'll get into the concrete. Just let it be a little bit uncomfortable because I need to stretch you a bit this morning. Now, in the 1970s, a mathematician, Benoit Mandelbrot, when IBM produced the computing capability, came up with a form of mathematics that was well known through the centuries, but we didn't have the computing capacity to actually apply. And it's called, or he called it, fractals. Fractals really are the idea that you have basic patterns that are multiplied in increasing complexity. And we see that in a snowflake, for instance, is a repetition of a very fundamental pattern. Using this approach, computer graphics people at Disney, Pixar, produce landscapes. So they produce these complicated, beautiful scenes using these simple patterns that are very, very real. In medicine, we're starting to use them to look at things like heart rate variability. In other words, we're not just looking at beep, 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 but we're looking at how the beeps relate to one another. And that's starting to give us an idea of how your sympathetic and parasympathetic nervous system is interacting. So it's as if we can move a level up in looking at things. And it's starting to give us a different perspective. And your cell phones no longer have antennae because they now have a fractal antenna. That is a self-replicating pattern that can engage in multiple frequencies. So you've got the benefit even in your pocket. Now, in biology, of course, we've got 4 nucleotides, adenine, guanine, cytosine, thymine, that produce all forms of biological life. A very simple pattern, rearranged many ways, producing incredible complexity. So that's where science is going. But that's not where medicine is today. Because you see, medicine 400 years ago wrestled its way out of a very religious, superstitious type of framework that many felt, and not entirely unjustly, was too limiting. And so medicine pulled away and started to develop a form of objective evaluation that ultimately formed the therapies that we use today. So our temple is the scientific method, and the way in which we worship there is to do randomized, double-blind controlled trials, because that is the way in which we serve that particular view. But of course it has limitations, and it is not in keeping with the advances that have happened in other sciences. It hasn't kept track with physics. It hasn't kept track with mathematics. It's only catching up now. However, we're being forced to change, because we cannot solve the problems related to aging using healthcare. Even though we have the right remedies, it's not solving poverty and disease in the world. 1 million people or more die of malaria every year, and it's entirely preventable, even more from poverty. So clearly healthcare is not the final solution. And then we've got increasing evidence, scientific evidence, that shows that there's more than we thought we knew. And this is actually a wonderful book written by Mario Beauregard of Canada that probes the issues related to the spiritual brain. And he uses things like functional MRI, mystical experiences, near-death phenomena, and so on, to really make a very, very good case using objective information. It's a very, very good read. So with that overview, let me then encourage you in this way. We're not going to change unless we think differently. And so we need to start deciding or agreeing to think differently. And with differently, I don't mean way out. I mean that if there are 2 conflicting views, there must be a higher level in which they can be reconciled or at least discussed. There is a change. As Victor Hugo says, you can resist armies, you can't resist invading ideas. And it looks like spirituality and faith is going to be changing our society. This is 2009 Time magazine, and it's happening more and more. And even Canada, that probably has the highest number of atheists in the world, it's still only 1.9% according to local polls. So about 98% of humanity, including Canada, it's even higher in the Orient or Africa, have a spiritual and a religious worldview. And people who are ill are going to have a spiritual interpretation of their problem. And if we disregard that, we either have a resource that we didn't use, or we have a liability that we didn't recognize. And often it's a combination of those two. So what we're trying to move towards is an opportunity to address these things in a way that is safe for you and for the person you're talking to. Of course, there is not consensus about, sort of a theistic or divine view of the world, and there are ardent critics such as Richard Dawkins and Stephen Hawking. But I have to say that even though they can come up with explanations of indefinite amounts of time or multiple versions of the universe to come up with whatever we have now, they find it very hard to explain the laws that our present existence obeys. So they can explain the furniture in the room, but not who put them there, or why a chair looks like a chair and obeys certain principles. So we need to be very, very cautious not to get into the trap of proselytizing people into atheism. And I'll explain the danger of that. Sometimes we have this view that our scientific perspective is the real truth, and we need to educate people out of whatever their beliefs are. I want to warn you that there's a risk either way, and I need to explain why that can be dangerous. Now, in terms of the whole business of health and faith, one of the greatest critics is Richard Sloane. And his primary objective is that people from a religious or a faith orientation sometimes do stupid things in blind faith. And quite honestly, he's right. He overstates this, perhaps, but it is true that sometimes religion or spirituality can be contrary to a person's physical interests. And I'm going to outline those for you. Okay, so let me just remind you, I'm going to take you back to these patterns and I'm going to build them up for you because that's going to be the model that I think is going to join some dots that most of you knew intuitively but have not yet had the opportunity to apply. But before I get there, let me first justify why we should even bother. Why should we bother asking people about spirituality if what they're there for is an IV and a dressing? Well, the answer is, in most polls, patients say they want it met. So patient-centered treatment would involve addressing spiritual issues in terms of the majority. Secondly, and it may be different here in Canada, but the Joint Commission and Centre for Medicare and Medicaid Services insist that acute admissions, chronic admissions, and home health care admissions require a spiritual inventory as part of patient management. So there's actually a precedent in America that requires us to do that. Nursing textbooks include spirituality, some of the leading ones. Medical faculties, about 100 out of 140, are including spirituality now as part of medical training. Aging populations, ongoing healthcare challenges are insisting that we look at other levels. And finally, we realize that using communities of faith as resources to care for people may actually be a good idea. And we're seeing more and more partnerships between healthcare systems and communities of faith. And the discomfort that used to exist, the superstition on the side of the church, if you want to call it that as a collective, and the arrogance on the side of medicine has been beaten to pieces on the anvil of reality. And we now need to take hands and to deal with our failing systems. If I could summarize what I'd like to deposit with you today, it's going to be this slide, and that is that you are able, and you certainly will be able, to meet or at least address the spiritual requirements or needs of the people you care for without a need for prolonged training, prohibitive investments in time, without provoking offense, without projecting judgment, precipitating guilt, promoting alienation, perpetuating superstition, or propagating magical thinking and escapism. The spiritual dimension provides meaning and comfort, greater partnering and compliance, restoration of relationships, and relief of suffering. Therefore, we cannot allow our own ignorance, prejudice, or fear to prevent us from addressing the spiritual needs and realities of our patients. To do so is to deny their reality and human dignity. It limits access to essential resources in the healing process and therefore violates the very tenets of our profession. Okay, now with that mini sermon out the way, let me move into the flesh and bones here. Let's look at some definitions that I mentioned earlier. There are three components to the broader term spirituality, and I mentioned them previously. They were mysticism, religion, and spirituality as a subset of this. Now, if you want to open a conversation with someone, the easiest way to get into this area is to say, do you have any spiritual interests, needs, or concerns, right? So spirituality is a nice neutral term. It doesn't presuppose any religious orientation, and most people would not be offended by being asked this. We'll talk about timing later, but it's a neutral term. From a research point of view, it's useless. It's just too broad. So what we do is we narrow it down, and mysticism involves the pursuit of, let's call it, advanced religious understanding, searching of the mystical texts, going into the sod level or the different levels of understanding to try and acquire additional insight at that level. Religion represents the behavior, the organized way in which we integrate it into our lives, whereas spirituality, as it is measured today, usually relates to the more experiential components. So what we find is that in Buddhism, for instance, it tends to go into the more mystical sort of forms of the pursuit of knowledge and so on in one direction. If we look at New Age, it seems to pursue especially the experiential component specifically. And if we go into religion, Islam is very focused on some of the behavioral aspects. So there are different dimensions, and each religion has a specific focus of these three components. And again, my purpose is not to talk about religion. I'm speaking about spiritual physiology. So that's how mankind has organized the spiritual awareness. Now, Ken Wilber produced a very interesting book contrasting sense and souls, science and faith, if you like. And he identified three domains, and you'll see they're very similar to the previous. Science pursues information to decide what's true. Religion or morality pursues what's good, right and wrong. And art and beauty is able to pierce something in us. We don't necessarily know why a sunset is beautiful. It's not right or wrong, but it appeals to something in us that we experience very strongly, although it's not in the language of science or necessarily in the language of morality or religious behavior. Now, why we get into battles is because science and spirituality, and I'm using spirituality in a broad sense now, answer different questions. Science determines what? The facts. Spirituality addresses why. So, when science finds facts and wants to apply them, it now needs to do that in a community context with a bunch of human beings that will have a religious view or spiritual view or certainly a worldview. And that's usually where this tug of war happens. Now, for many of us, we tend to think, science is objective and faith is this, non-specific thing. Well, if you'll allow me to shock you a little bit, let me tell you that science, or at least the scientific method, and true faith is actually very much the same thing. And let me explain what I mean by that. A p-value. We'll all do research, do a little sample, derive a p-value. What is the p-value? The p-value is the probability that your little petri dish or little group of patients, that what you found there applies to a broader population from which you derived that sample. So that's your significance, and we accept a p-value of 0.05, meaning we accept a 5% chance that it was fluke, right? And if the chance is less than that, well, then we think it's significant statistically. Then we derive a confidence interval. What does that mean? It means that we are 95% certain, for the most part, if we use 95%, that there's going to be a range of possible true answers, any one of which may be equally true, that now applies to this larger population. Not the sample now, the larger population that we're really trying to get the answer for. And that range is often very large. So what we're really saying is that we have faith that the chances are less than 5% that it's fluke, and 95% that we're in the window. And we're using the experience of our little experiment to apply into the future. And that is actually what faith is described as. It's using the experiences of the past and applying them into the future. So in that dimension, they're not at war, but they use different language, and that makes dialogue quite tricky. Now let me show you where we are in the pursuit of health. What do we study? We look at pathogens, things that make us sick. We look at predisposition, in other words, why we're vulnerable to that. And we look at pathophysiology, we look at how that produces disease, and then we study the disease or disorder. And then we form strategies. And these strategies are very interesting. Allopathy means we decide we are going to oppose the disease process. So you've got a runny nose, I'm going to give you something to dry it up. Or we use homeopathy. We give you a micro infinitesimal dilution of something that should make your nose run, and you take it, something happens in the body, and your nose dries up. Or we prescribe an alternative therapy, from needles to magnets, to interrupt whatever the process is between the origin of whatever causes the disease and its manifestation. The funny thing is, all three of these approaches work at some level in randomized trials. So there must be something upstream for this to make any sense. Now, of course, for the past 30 years, there's been greater legitimacy in understanding the emotional impact, the so-called deadly emotions. The problem has been we're trying to find out the mechanism. So we are trying to employ our mechanism, physical, biological metrics in an area that works on meaning. And it's been very, very hard to document. Now, of course, they found that stress and hostility, and I'll mention some of these do cause physiological disruptions. But there's more to that. Plus, how do we deal with this? Well, we start introducing yoga, psychiatry, psychology, but often, because this has to do with meaning, the secular intervention is at odds with the person's actual religious worldview. And that actually forms a clash in many cases. A clash that we don't recognize. We just think we're helping people to get smarter. Meanwhile, we're often confusing them, and we don't even appreciate that risk. And then we have to ask ourselves, well, is there something upstream of that? And I think most of us in this room would recognize that there is more to our experience of life than what we can see, touch, smell, and feel. But how does that play into this? In a way, it's like the drunk man in the middle of the night, looking for something, a boy coming up to help him, say, "What you doing? Lost my coin," helps him, and after a while says, "Are you sure you've lost your coin here?" The man says, "Oh, no, I lost it in the dark alley, but the light is better here." And in many ways, that's where we are with science. We are studying where we can see, not necessarily where the problem is. But how do we bridge this gap? How do we bridge the gap between spirit, soul, and body? And that's what I hope I'll be able to answer for you today. I'm going to give you two frameworks. This is the one that's been well published. There's a book on religion and health. It's 700 pages. The first edition was 2001. And it's now going to get its second edition. Each of them quoting about 2,000 papers in peer-reviewed journals showing that faith has impact on health, for the most part positive. How it works is they study different parameters of religion, then look at especially mental health, social support, and health behaviors as the mediators. In other words, if you are in a religious framework, you're likely to think straight, have some folks around you that care for you, and not do harmful behaviors. Therefore, you're less likely to run in all these derangements that may manifest as certain diseases. It's called structured equation models. And it gives us a sense of which direction things are going. And to give you an example of what this sort of research has shown, is that there's a study that showed that at age 65, your chance of dying within 5 years is as great if you smoke, than it is reduced if you have an active faith life. Just to give you an idea of what sort of magnitude we are sometimes talking about. So it has definite effect. But for you now going out to see a patient who's had venous stasis ulcers for the past 20 years, it's going to be a little bit hard to integrate that into your practice. And this is where I hope I'm going to be able to give you a key. It's a straw man. I know it's oversimplistic, it's primary colors at best, but I think when you search and apply this in your own practice, you're going to see how robust it really is. Let's start off with the familiar. I think as you're sitting here, most of you would agree that at the level of the mind, the soul, the psyche, whatever you decide to call it in whatever language, there's a capacity to think, there's a capacity to decide, and there's a capacity to feel. Now, if you go upstream and you look at some of the split brain studies where people have had a transection of the corpus callosum, what they found is if you ask the left brain whether there's a deity, it answers no. If you ask the right brain, it answers yes. Now, that doesn't mean that you've got a little, sort of divine spot in the right brain. What it means is there are different approaches. Some of them are entirely rational, but some have a different capacity. Some of them have an ability to relate at a different level of reality. And it's too common throughout mankind to be called abnormal. One of the words that has been used in a publication by Watchman Nee is communion. In other words, the capacity to relate to an invisible entity, either just from an experience point of view or from a relational point of view. There's also the capacity for conscience, the ability to decide right or wrong. And there's intuition, which means you have the capacity to feel or experience without it coming through your physical senses. Now you can see that those seem to sort of mirror one another at different levels. And when I saw this, I got very excited because I thought if there are 3 in the spirit, 3 in the soul, there must be 3 in the body. And I was stumped for a long period of time until I remembered embryology. And what I'm going to show you now is Howard Hughes Medical Institute's little video clip showing accelerated fertilization through the development of the trilaminar embryo. Okay, so let me walk you through it. There's the ovum, fertilized, dividing, going down the fallopian tube, heading for the uterus. As it goes, of course, it divides and ultimately reorganizes as an outer cell mass that forms the placenta and an inner cell mass that will form the entire organism. As it goes and actually embeds inside the uterus, it will start dividing into 3 layers, and what I want you to notice is the themes. The outer layer is called the ectoderm, outside skin if you like, and that forms brain, nervous system, skin, special senses, and everything around the head. So basically everything we use to relate and communicate and signal throughout the body. The middle layer has to do with matter, movement, blood, lymph, heart, kidneys, muscles, joints, locomotor system. And the endoderm has to do with resources, has to do with energy, oxygen in and out, nutrition in and out, storage in the liver, build up and break down through the hormones. So you can see that there are themes. This is the detail, but I want to show you the pattern. Ectoderm is focused on information, mesoderm is focused on matter, and endoderm is focused as a theme. Remember, I'm oversimplifying to show you the picture on resources. Now, let's follow this through. Let's say conscience. Your conscience determines you should or shouldn't do something. You then decide, will I or won't I? And finally, you actually submit your joints and muscles to doing it or not. So there's a continuum. You've got an experience and a spiritual worldview, even if you discard it, but there is one. It relates to how you think and ultimately how your brain, nervous system, and skin functions. And we see that in all our relationships. We have a thought, and it manifests to crying, smiling, and so we signal to one another. You've got intuition, emotions, and endoderm. And in fact, we use these links intuitively because we talk about this as gut feel, right? So we refer to many of these things already understanding this continuum. Now, what pushes your buttons? Because what I need to get to is how the system starts dysfunctioning. And if you think about it carefully, the bad things that come your way are in three overall categories. Remember, again, it's oversimplified, it's primary colors, but if you stay with me, you're going to be able to unpack a bunch of things in your own life and that of your patients. And I'll use examples just now. Things that come as a threat produce fear because they threaten whatever you believe your security is. An offense is an assault on what you believe is right or wrong, or just or unjust. And an insult is an assault on whatever you value. And that produces shame. All right? So threats produce fear, offenses produce guilt, blame, hostility. It's that sort of angry axis. And insults produce shame. And of course, we read descriptions of that in some of the earliest texts that depict those very, very clearly. Now, what you find if you look at mind-body medicine is that the organs that derive from the different layers of the embryo are uniquely vulnerable to each of these. So we find that the ectoderm is very, very vulnerable to threats and fear. And we see that many skin diseases are so-called neurodermatitis. Mental diseases are the products of fear. Schizophrenia, the dissociation is in a fear environment. PTSD, those are all threats that cause derangements in organs related to ectoderm. Guilt and hostility, anger, rage, seem to affect mesodermal organs most commonly. And shame, devaluation, or lack of self-esteem seems to specifically affect endodermal organs. Now, of course, organs are made up of multiple layers. Don't think I'm trying to oversimplify. I'm trying to show you themes because that allows you to start approaching things in a consistent way. Now, I've made some bold statements, so let me back it up at least with some science. I don't have enough time to give you extensive overviews, but at least humor me in saying that psycho, neuro, immuno, endocrinology already identifies those three layers. Psycho is mind, neuro, ectoderm, immuno, mesoderm, endocrinology, endoderm. They don't realize that, and I don't think anybody's ever published that, but that's actually how they already understand that the mind-body connection actually breaks out. There's a lot of work showing that if you're anxious, your ectodermal system misbehaves. This is just one example. Anxiety causes palpitations. Now, you might say, but that's the heart. Well, yes, it is, but which part? It's the regulation. So it is the innervation that is disrupted. So it's still consistent with the ectoderm being dysfunctional, but it obviously has an effect on other organs. All right, so just hang in there. Let me show you another one. The Framingham study, big cohort, looking at cardiovascular disease. They start drilling into personality, find out who the people are that get heart attacks, and they find, lo and behold, people who have type A, or more specifically, are hostile. In other words, are angry towards other people, are most vulnerable. So there is an anger, guilt, blame, rage interaction with mesoderm. In fact, our idioms are quite smart. We say a person's blood boils, and we now see that platelet aggregation and various blood coagulation factors become activated in a state of anger. We don't know the exact mechanism, but we do see the phenomena. Lastly, 20% of America has irritable bowel syndrome. Nobody knows what to do. There are all kinds of models to try and deal with it, basically either strangling your intestines or paralyzing them. But if you ask people what is the consistent way in which this develops, without exception, they will tell you stress. But if you ask them what sort of stress, it's a very specific type of stress. It's fear of abuse. It's fear of being exposed in a devaluing or shameful way. Now, for the executive, it means going in front of his board of directors and basically being told he's incompetent. For the young woman, it may be the fear of being molested. It may be an emotional thing. It may be a verbal thing. But, and I can see some squirming in the seats. Think about it. Our body tells the truth. We've just forgotten how to learn or understand its language. Okay. Now, how do we resolve this at the level of mankind? What's the big picture? Well, what is science really? Science is really our attempt to overcome our fear, because we want to control our world so that we can predict it. So we use science to try and deal with our fear. Religion deals with behavior, so we use that to try and deal with our guilt. And art, the beautiful, is something we try and use to deal with a sense of shame. And those are strategies, and of course different cultures apply them in different ways. Now, let me bring this absolutely home to your everyday practice. You may not know where to start talking with someone about spirituality, but what you can talk about is meaning. What is the meaning and purpose of their lives? And an atheist who may vehemently oppose any sort of spiritual belief would nevertheless have to be living for something. And the meaning, if you look at Viktor Frankl's work, and he was an Austrian Jew who survived the death camps of Poland and Germany and tried to discover what it was that kept some of the people alive, he found three things. It was those that were doing something significant, those who were experiencing something significant, and those that had a belief towards something significant. Information, matter, energy, or relationship, resource, ritual. Let me move that up a step. When we look at healthcare, nowadays we get into this whole nature-nurture debate. It confuses the actual issue. What are we talking about? What we're really talking about is resources. In other words, what were you given, and relationships. Who do you apply them with? But there's a third dimension, and I mentioned that previously, is the ritual. And that's why something like this chicken is so brilliant, because there's an existing relationship that already exists between the faculty. Here's the resource. What they're trying desperately to figure out is what's the ritual. So they're throwing it around, or, there needs to be this third component. It's missing. And so we do it with everything in our lives. Your next cup of coffee is a relationship using a resource in a ritual. It relates to how we get married, how we make love, how we eat. Everything is a construct of these three things that produces meaning. In advertising campaigns, they say if you just have the right resource, you'll have meaning. Okay? And so each of these approaches tries to show you what the missing piece is in your life. But we need all three. And here's the problem. We have focused in Western medicine almost exclusively on the resource. In other words, we have focused on what actually works and neglected the relationship. Canada is an exception, and the wound care community is an exception, because the relationship is critical. When you get a patient walking in your door, you know whether you're going to help them before you even know what their disease is. Why? Because you know whether there's a relational capacity or not. Okay, so we do know that these things ring true. So what are we using? We're not taking our patients for coffee. But what is the healthcare construct that combines relationship, resource, and ritual? It is, ladies and gentlemen, the placebo. And that's why we've had such confusion about this, because we say the placebo response is a non-response. I want to defend that the placebo response is a biological expression of spiritual and psychological physiology. Let me say that again. The placebo response is an expression of spiritual and psychological physiology. Let me illustrate that. We all know what we use placebos for. We use them in double-blind randomized trials to basically rule out the effect of the procedure itself. But let me show you an example. This is a study in people post-stroke taking antidepressants, and the pharmaceutical company will say, well, this group is really helped significantly with this agent, whereas Prozac is useless. Well, of course, that isn't true if you look at the scale, but what nobody reports on is that the placebo actually has 30% of the effect of the active ingredient in a tightly controlled trial. So what's the point? The point is that taking a pill is not inert. Just taking a pill is not inert. The color of a pill is not inert. Let me give you some ridiculous examples. Everywhere in the world, if I give you a blue pill, doesn't matter what's in it, it'll be sedating, except in Italy. Because in Italy, they have a soccer team, the Azures, that are blue. In Italy, a blue pill is a stimulant. I kid you not. Let me give you another example. In Germany, if I give you a sugar pill and tell you it's a proton pump inhibitor, it'll give you a 75% cure rate for your peptic ulcer. In Brazil, if I give you the active agent, it produces a 67% resolution. So a sugar pill in Germany is more effective than the active ingredient in Brazil. Now everybody jokes and say, yeah, but you must know the German doctors say you must take your medicine. No, it's got nothing to do with that. It's an orientation to the meaning and significance of that ritual. Let me show you one more thing, and I know I'm going to keep to time, but I want to deposit this understanding because it's going to unlock something that I hope will really allow you to start thinking at a different level. This is a simple headache study. People take 4 tablets. Sugar pill, unbranded. Sugar pill, branded aspirin. Aspirin, unbranded. Aspirin, branded. This is the equivalent effect. It increases the effectiveness. So what is that? Is that placebo? No, because some of them actually have an active ingredient. So it's not placebo as we understand placebo. But as the meaning of what you're taking increases, so the effect increases. And that is why we must not underestimate the value of spiritual and psychological issues in healthcare. One of the greatest mistakes I made in medicine was to basically say everything that I could not prove was nonsense. And what I did was deny people the meaning that they did derive from many things that they found helpful. I produced a negative placebo. Now, of course, in hyperbaric medicine, there was so much abuse with all kinds of diseases, we had to have a certain guarding. But I want to caution you about ridiculing people's spiritual or other healthcare practices if they are not inherently harmful or somehow exploit the individual. Don't just ridicule them if you don't understand them, because they do and may have significant effects. The body does respond. And we see this real scramble when we look at what healthcare has done. This is sort of a short history of medicine. Eat this root. No, say this prayer. No, drink this potion. No, swallow this pill. Take this antibiotic. Eat this root. We've gone round and round. Why? Because as our culture has changed, that which has meaning to us has changed. And therefore that which is effective for us has changed also. Without that understanding, it really makes no sense. Now, how are you going to approach this whole area now that you've got this whole scaffolding of thought? Well, it's really relatively simple. You ask the patient what their needs are. And why I've given you such a large framework is because I don't want you to diminish it. I don't want you to ridicule it. I don't want you to think that because your views are different to theirs, you can't talk about it. I want to open this up for an interhuman safe place to realize the importance of a person's spiritual worldview in the context of their healthcare. Most people say we don't have time. Well, then at least ask one question. Ask them, are there any spiritual needs or concerns? And you know what? Your particular practice of wound care probably represents the single greatest, most influential area of healthcare to impact people at this level. Which is why I'm here making this deposit, because I think you can make a greater difference than most other areas of healthcare ever will. Because you've got more time with them. And you can develop the relationships that backs that up. Let me show you the first example of healing from the Bible, if you like. Abraham. And there's a bit of humor in this. Abraham goes into the land of the Philistines, takes Sarah with him. She's 100 years old, still quite attractive, and they've got an understanding that he's going to say she's his sister so they don't slit his throat and steal her. So they go to the land of the Philistines. Abimelech takes her into his harem, bit slow on the uptake, and a strange disease develops in his harem. Rabbinical sources say it's a venereal disease because no one's touching nobody in there. So after a while, Abimelech gets a dream, And the Lord appears to him and says, Abimelech, you've got another man's wife. He says, I didn't know. The Lord says, that's right, otherwise you'd be dead by now, but you better fix it. So the next day, he's out, got his camels, Sarah in tow, restores the relationship, and here's a fascinating thing that happens. They square away this whole lie business, so they deal with the relationship. Then Abraham prays for Abimelech, and Abimelech and his household is healed. Now, those of you that have a biblical worldview or use a Bible, we tend to look at chapters and verses. And we stop at the end of the chapter and we don't read the next verse, because the next verse is, and the Lord visited Sarah and she conceived. In other words, Abraham prays for Abimelech. His fertility is restored. And subsequently, Abraham's own fertility is restored. That's the dynamic. In the later scriptures, it's confess your faults one to another and pray for one another so that you may be healed. That would be the reference. And that is the original model. Look at Job, the classic example of a wounded person with a long-term condition. The captivity changed when he prayed for his friends, when the relationship was restored in a meaningful ritual. And I'm not detracting or denying the supernatural that it may represent. What I'm saying, it is a construct that is deeply intrinsic in the wiring of mankind. And we need to be aware of this. Now, some do's, don'ts, and dangers in the 10 minutes that remain. We can find that a person's religious worldview can introduce hindrances from our perspective. A Jehovah's Witness may choose not to have a blood transfusion rather than to face, in their view, eternal damnation. You know, on the scale of things, the blood just isn't that important. And if you approach it purely from a mechanistic, biological point of view, you're going to miss that person's heart entirely, and you may not even be able to have discussions about alternatives. So we need to understand that. Of course, as humans, what is different is usually wrong, and therefore if the person has a different worldview than you do, we tend to become judgmental. And we experienced that yesterday, the tension that emerged when there was this patient that possibly might be having a secondary gain with the illness. There was this immediate, well, you know, that may be wrong, and, you know, this whole sense of right and wrong and judgmentalism. We struggle with that because we try to remain objective, but we are humans and we have hearts. It may result in alienation or isolation in terms of being in a different setting than your own religious worldview provides. It produces strain, can produce disagreements. People can get into fear faith. They may want to sort of bribe the arm of God to help them. They may go into a weird place of social neglect, you know, where they have this epiphany and they neglect all their obligations in society. They may have extreme guilt, and one of the most dangerous we call negative religious coping. They think they've been abandoned, they think the deity that they're praying to isn't listening, and they're in deep, deep doo-doo. So those are potential hindrances, but they're real. So you can ignore them, but they are real. And it's better that we know what we're dealing with. Now, some of the dangers are that if you pounce on people with oil and prayer and they have a different view and you don't have their permission, you can deeply offend them. And I don't think you can approach anybody with a prayer as much as you can approach them with a needle without their consent. Same principle. I think it's important we respect that. We need to know that they may also be offense within the family or support system, and the greatest danger is when we're not respectful or mindful. We can also cause potential concerns that they feel, well, we've spoken to them about spiritual things, so we think that they must have sinned. And that can be a barrier if they don't understand that hating yourself or being angry with yourself or rejecting yourself is a sin in terms of it is a violation of the principles on which the body operates. So sometimes we need to reframe these things. The unintended messages, you know, if you start praying for someone in intensive care, they may think they're really in trouble. So they may think it's like calling the priest, last rites sort of thing. So we need to be very careful how we approach it. Of course, once you ask the question, do you have spiritual needs, they may start asking you some questions. And you need to know whether you're prepared to deal with that and how you'll deal with that. And if you don't, or don't want to, you should at least still offer them the resources that can deal with it. So let me now move to the more positive in closing. Religion is a help in helping people to cope. It can strengthen your relationship with your patient even if you have different religious views, simply because you've honored theirs. It can motivate them to comply because they know you're not just a veterinarian. You're not just handing out pills or props. It also gives you the opportunity to solicit community support. If the person is in a community of faith, they can start moving the patient to and from the clinic and provide part of the resource package. It is shown to alter the course of some illnesses, such as depression, and you may find that your burnout is less when you are able to add that extra layer of meaning to what you do. Because much of the ache that we experience as healthcare providers is the absence of meaning and purpose we sometimes experience. Why? Because we haven't got a framework to engage at that level. So how do you avoid getting tripped up? Well, you start with the patient. Patient-centered approach. You obviously follow priorities. You put your finger on the spurting aorta before you start praying. All right? You may want to pray before you do the surgery, which may be appropriate, but from the patient's point of view, you need to deal with priorities in sequence. Get to know the person before you get into these sensitive areas. Asking about smoking and social habits is usually an idea of whether the person's going to be receptive. Ask the basic spiritual history. If there's agreement on some sort of religious intervention, make sure you've got complete consent. Ask about sensitivities. Some people may not want to use the name of God. Some people may have a different use of the deity. And if you do want to engage in an appropriate way, it's sometimes possible to just ask, how would I be able to intervene at this level without causing you any offense? And it's possible to do that without getting into a compromising either side. And always be respectful. I'll give you a copy of these slides because the evidence is relatively clear in terms of that we should address spirituality. The mechanisms are usually mostly stress-related. And so I can really just go over these fairly quickly. And that is to say that stress causes predictable problems through various mediators that you're familiar with. Healing rates are definitely deteriorated when people are in stress, and dealing with stress improves it. So even just from a stress management point of view, dealing with spirituality is a helpful resource, and there's a lot more to it. We actually have an ongoing study at the moment to look at people's state and trait anxiety, perceived illness scores, negative religious coping after a specific intervention, and seeing how that impacts on people's health. And it's quite possible to do these sort of studies, and I think that they're very important to be done, particularly in the area of chronic care or chronic problems. Lastly, resources. If you want a basic how-to book, Harold Koenig's book on spirituality and patient care is a wonderfully concise, well-written book that gives you the how, what, when, and where, gives you some ideas of what the basic things are to avoid, and just gives you a framework to engage. Very good from that perspective. The link between religion and health explores the way in which psychoneuroimmunoendocrinology is affected by faith and religion. So it gives you specific ways and specific mechanisms that have been studied. If you're interested in partnering with communities of faith, there's some resources on so-called parish nursing, but also on building good relationships between medical and religious partnering. If you're interested in doing research in this area, Harold Koenig produces in the summer months, so it's usually July and then August, a research workshop over 5 days that I've attended, really enjoyed, and he gives you the instruments that can be used, and also some of the grant opportunities if you want to explore how faith influences health. There are many validated questionnaires that can be used on anger and forgiveness and hopelessness and so on that would be very easy to use, and there are well-published resources. And ultimately one can show how acknowledging these aspects produce clinical change. There's some good references on the psychoneuroimmunoendocrinology, both overviews and details. And if you want to really start looking at mechanisms, this is an area that I've become very interested in. Let me just give you a quick framework as I close. Have any of you heard of vasoactive intestinal polypeptide? Not recently, and certainly not last night, I'm sure. But basically, when you have a full stomach, when you've had a nice meal, that sort of, That feeling, that is associated with vasoactive intestinal polypeptide. Now, it's released with a distended stomach. When it's released, and its function in the body includes things like strength of the heartbeat, movement of the ovum through the fallopian tube, the development of the brain in the child, modulation of the immune system in the lung to produce less inflammation, and also allowing CD4 cells that are hyperactivated to ratchet down instead of committing apoptosis or undergoing apoptosis. It is the molecule of fulfillment. If you think about some of the ancient languages, and modern languages to some extent, a full stomach is a representative of a full life. L'chaim is a full stomach. It's the image of life, but it's a full stomach. In medicine, we refer to chyme. Chyme is stomach contents. So there is not only a symbolism between a full stomach and life, there's actually a neuropeptide link. Now, here's the interesting thing. HIV virus enters cells through the vasoactive intestinal polypeptide receptor. In other words, it goes through the signal that is supposed to signal life to a cell to produce a corruption leading to wasting. It sheds all its additional receptors, blocks whatever other VIP receptors the cell has, and denies it the opportunity to experience fulfillment. So these things actually interact and interrelate very, very closely. And I think we need to extend our understanding of some of these things. The way in which oxytocin and vasopressin actually change our attitude to people in relationships are very much aligned with this whole mind-body medicine principle. So it's a fertile area. So I close by saying I'm not suggesting that people work outside their area of religious comfort or knowledge. What I am saying is that you should realize that your patient has a spiritual worldview in 96% of cases. And that you would do well if you at least identify what it is, whether it's your ally or in some respects an adversary that needs to be handled in an appropriate way, and that you can extend your compassion in a deeply meaningful way that will both benefit your patient and you. I'm sure this was not what you expected. I hope it's more than you bargained for in a good way, and I hope that it will lead you to think at a different level and know that those things that you intuitively understood actually have a very plausible connection, and I encourage you to pursue them further. Thank you.